Hi.
Hello, everybody. My name is Ken Abrams. At Deloitte, I serve as the firm's Chief Medical Officer.
Good afternoon, everybody, and thanks for taking the time to spend with us again today. I get the privilege of hosting today's discussion, where we'll talk a little bit about virtual health and specifically focus on some of the concepts around the ability to deliver hospital-level care at home. I am a physician. I'm an anesthesia critical care doc by training, and then I joined Deloitte 9 years ago now. I'm Deloitte's Chief Medical Officer for the U.S., and have the privilege of working with a group of about 65 physicians, clinicians, and scientists in the firm as we serve clients in lots of different ways across life science and healthcare. Talk a little bit about virtual health, and we'll get into the concept of hospital level care at home and what that looks like. Healthcare as we know it has really changed dramatically in the past months, right? Since we've all been living these virtual lives that we're living. Doctors' offices closed down, hospitals kind of shuttered a lot of programs and access to things because they've been overwhelmed, and a lot has exploded into the virtual environment. So I'm curious to know what you all have been seeing and experiencing and hearing and maybe even partaking in as it relates to, this new mode of delivering care, which isn't really quite new, but, we've moved the needle probably 5 to 10 years into the future.
Since quarantine, I have had to have some telehealth calls, not just for my kids, but for myself. And I feel like I have enjoyed them. It's actually been good. You get the phone ready and, it seems to be working semi-seamlessly, but I just feel like the level of care has been still very good. I feel like I'm having more email communications with my doctors, which, I'm 38. I kind of enjoy that too, because I feel like I also live this life where I'm checking my email. And I can check everything. I can see blood work results from years past. And so that just kind of makes me feel good that everything is in one central place and I have access to it at all times. And all my doctors have access to it. Because me having to see a hematologist and then a neurologist and then a cardiologist all in preparation for a surgery I'm going to have, it makes me feel good that everyone has access to the same information at the same time.
During the pandemic, everybody has turned into a telemedicine doctor. Your doctor, urgent care, the telemedicine doctors that existed already. But what they're lacking, and they're trying to foster relationships, but video conference, when you have a sore throat, makes like 0 sense. And I know, as a mother of 3 grown children in their 30s, when they were young, I really wanted that hands-on touch. The doctor knew their bodies, knew where a mole was, knew what looked different. And I think that it's going to happen. I think we've whet everybody's appetite. 2 things happen. One is we started to reimburse people for telehealth visits, and that's huge. And 2, people are using it more because they had to. Now what has to happen is we need hardware attachments in your home so that the doctor can still be on a video call with you, but can actually see in your throat, look in your ears, listen to your heart, hear your cough, etc. And I think that's what's missing.
I've seen telemedicine work really, really well for triage. Is this something where we need to risk going to an urgent care or going to an emergency room? And 9 out of 10 times, those telemedicine visits have taken care of something so that they don't have to go and be in more risk being in a place. The last place most of us want to be is an urgent care or a hospital. One of the biggest problems that people are reporting about is that you have to buy into an additional platform. So you don't just have to have the gadget, but either the provider or you as a consumer have to have an additional HIPAA compliant platform. So there's some struggles on both ends. We are so much further than we were 6 months ago, but we still have a long way to go.
I'd love to get your perspectives on what you see as the things that are going to either help continue to accelerate and advance the adoption and use and value associated with virtual health and telemedicine, and what things are going to be limitations and barriers that we still need to overcome.
We, from the point of entry of patients into a facility, we are asking them to be their own advocate and their own historian. Well, what if they don't speak English? Translation could be an issue or is an issue. Another one is documentation. And I mean, whether it be a paper chart or an electronic health record, you can bring a horse to water, but you can't make them drink. Like, it's that compliance of, we are so busy in healthcare. Do we even have time to now document what just happened? And of course, we're relying on that documentation as data. One that kind of ties the two together is the transition of care. So I know, Ellen, you kind of talked about it. It's that community to acute, acute to community, acute to rehab. It's that void that we have where all that information gets lost. I mean, we do it really well in something like medication reconciliation, where you can find out what the patient had been taking at home and then have it ordered in the hospital. That's somewhat easy. Where it becomes a little muddled is something like goals of care, a conversation that no one really wants to have with a patient, or, what is your plan of action?
I'd be so interested in seeing what ideas they would have for the future of virtual pregnancy, visits. It's like, do you want to hold the doctor up to your belly so they can see the size, or would you have to measure it? It's really interesting, or have a certain, you don't want to put your phone to your belly, but I know they have a lot of those heartbeat checking apps, and they're like, oh, turn airplane mode off. And I'm like, is that really helping that much? I don't know. I don't know about the waves of all of those things, but it'd be really interesting to see what they might have in a year from now if they're still doing virtual stuff. So I know that's a lot of questions that I receive daily. Like, are you going to the doctor? What are you doing?
Unity, I'm kind of curious, right, with your portfolio and as you're looking at startups, how much of this is focused on, creating these kind of devices and platforms and technologies?
A lot of these technologies have been around for years. There's been billions of dollars, close to $60 billion invested in the past 10 years in digital health technologies and innovation. And what we hadn't seen is much adoption of these technologies, both on the patient side as well as the systems or providers themselves. And what has really changed overnight is a forced kind of behavior change or adoption across the board. So these tools around diagnostics, around testing, around telehealth, are now seeing an overnight sort of transformation in terms of the use. Health systems, hospitals, clinics, they're very rapidly trying, if they didn't have virtual care solutions put in place, they're putting these systems in place now.
So I think the structure of the doctor-patient thing is going to change. A way to check in and gently remind you that you are due for something, need something, should take something. I think that's going to be part of this systemic change as well as telehealth.
The technology is actually relatively inexpensive. When you think about where all the other costs are. So when you get these things actually used at scale by all the physicians, by all the patients, I think there's potential to drive the costs down for the health systems, for the payers and for the patients.
Apps are starting to get certified by the FDA for mental health, for ADD, for diabetes, so that your doctor could prescribe an app as easily as an aspirin.
So I think there's going to be a big advancement in the long run where we're going to see significant reductions in the overall costs through the adoption of these technologies and capabilities. And I think one area, it's a good segue, right? So one area is that we're starting to see emergence is around this concept of hospital level care at home. And I don't know if you guys have heard much about that or not, but that might be a really good place to transition this conversation to, because it has the ability to actually dramatically reduce the cost of care.
I've been following a lot of stories of people who have had surgery and they were able to go home the next day because a team came in and set up everything that they needed to convalesce and recuperate in the comfort of their own home, but be monitored remotely by systems that are in place that have helped just tenfold down the road. I haven't heard any horror stories about things like this, even from my cousin who had a baby 3 days ago via C-section and was sent home 1 day later with everything in place at home. And she's been able to recuperate at home. It's been a great outcome for her baby, for her husband.
The aging, the elderly community who it's very expensive to go to the hospital. It's very disorienting. It's isolating. But to be able to age in place, and you're seeing things like fall detection systems. So if you don't take the fall in the first place, you can avoid the hospital visit. You're seeing, diabetes in particular with medicine reminder, with digital pill boxes, with nutrition that comes and Skypes in or Zooms in and tries to help your eating. All of these things will cut the enormous burden off of repeat hospital visits in the populations that most likely to have them, I think.
We are seeing the ability to actually deliver that kind of care today at home. So whether it's the post-operative recovery, right, from your joint replacement, your cesarean delivery, or somebody who's got pneumonia or cellulitis or vasculitis, right, bring them into the home, set them up with a digital toolkit, right, that's necessary to continue the monitoring, pulse oximeter, blood pressure, spirometry, whatever's going to be needed based on their underlying conditions as well as the acute condition, right? And instead of admitting them to the brick and mortar of the hospital that we know, admit them to their home, right? Enroll them in their program, connect them with the devices to a command center, kind of like we've got running now, right? Where I can see those vital signs that come in, the results of their blood glucose as they're checking it, right? And all of those components. If we're talking about the elderly, how many elderly get disoriented when they get admitted to the hospital? Elena, you probably see it all the time.
That is the number one thing. They're delirious, haven't drunk, then you get tested for UTI and then all this other stuff, and then they're admitted. I agree with everything that's been said. We really try and keep people at home as much as possible, and that's one of the challenges we have is building up that community support, so they don't even have to go to the hospital.
What do you think is going to happen over the next 3 to 5 years with devices in the home, hospital level care being administered in the home? Right now we're going back to Marcus Welby, which I should have said earlier, right? But where is all this going to take us? And in order for this to create the continuity of care that we were talking about earlier, that Anna, I think you brought up, and Alana reinforced as well, what has to be true for all of this to really take hold, and for us not to call this virtual health or hospital level care at home, but to just call it health and care.
There are so many new devices on the market that incentivize consumers to run a little bit faster. For instance, there are headphones that tell you, okay, you're slowing down, go a little bit faster. Different devices that can motivate you in different ways. The issue being that these can be really cost prohibitive for consumers. And even in speaking to the panel last week, and a lot of times when I'm writing an article or working on a story, a lot of times my editors say, okay, remember, we are in New York, but you're writing for Middle America, and the things that you're up for doesn't, sometimes it doesn't resonate there. And I think that one issue is the cost issue. A lot of these devices are over $100, usually minimum, right? Mm-hmm. The newer ones are even pricier. And I think that there's also an issue with privacy that we all echoed this concern of this data being fed to an insurance company or elsewhere.
Where we're going 5 years, 10 years from now are from who did you say, Marcus Welby to real Star Trek, where you walk in, your home, we'll make it the right temperature, we'll read your temperature, we'll hear if you have some asthma, if you have some kind of flu symptoms, if you have a cold, if there's a little hitch in your get up and maybe you're stiff or sore, or homes are smart-ish now. 5-10 years from now, all of that will be built into our homes and into our surroundings. But back to Anna's point and Robin's point, it will be cost prohibitive for the average person.
Two significant things. One is just getting the whole quote unquote world used to using these new technologies that have been around for a long time is one significant transformation, is just the user adoption, both on the provider side as well as the patient side, as well as just workflow, getting it just sorted out. The second big thing is improving design. Now it's all fragmented. They're all impossible. We need to have beautiful, invisible design where people aren't thinking about issues like privacy or how to turn something on or off. It's just got to work, and more consumerism, more retail kind of design experience built into the whole process. And I think we'll see a lot more of that over the next 5 years.
Now, if you could just afford it, that would be the icing on the cake.
At scale, the prices will come down. It's just going to take time. And we were talking about ultrasounds. Those at-home ultrasounds used to cost $100,000. They're now a few $100s.
If you guys took out your magic wands, right, and you had one thing that you could do to push us into the future and actually continue to the acceleration in the adoption and the integration and the continuity, everything that we've talked about, what would you change?
I'm going to go for personalization of medicine in general. That everybody's like, a body with a problem, with an eye ache or an earache, but it's all, the more you know about your person, the more the drug, whether it's a drug or an app or anything is suited to you. So I'm going to go with more personalization of medicine.
I would love to somehow wave a magic wand and have healthcare be accessible and affordable for everyone across the board. That's my pipe dream.
I love all of these ideas, and I totally think personalization and for it to be affordable is so important, because before I was pregnant with my first baby, I did not have insurance because I'm self-employed, working at a restaurant. I can't afford health insurance. This is crazy. So I think even feeling like I couldn't afford insurance before I had a baby, and now having paid for it the last almost 3 years, it's I could afford it, but I didn't know what to look until I was needing to look for it. So I definitely think making it personalized, affordable, and maybe just less intimidating.
My husband has incredible insurance. He's a high school teacher. C-section that involved 3 teams because I had a team for me, a team for each baby, $15. Best check I ever wrote.
I would, magic wand, love health and care to be designed into the fabric of our lives invisibly so we don't even know it's happening, and we're just kind of taking care of ourselves incrementally day by day to stay well and healthy. And it must be affordable for everyone in the world. Jennifer, I loved what you said.
I do want to thank everybody for participating today. This has been a really engaging and stimulating conversation. I have learned a ton from all of you. So thank you for sharing your thoughts and participating. We really do appreciate it.
Thank you, everyone.
Thank you, everybody. Have a wonderful week.
Stay well, everybody.
Stay well.
Thanks so much for moderating. Take care.